I've been writing this big article that's titled 5 Things to Know and Do to Keep Your Shoulders Healthy and Moving Pain-Free. And so I came up with this 5 bullet concept that one needs to know and practice to keep their shoulders healthy and to stay pain-free. So what are those 5 things that will help you to keep your shoulders healthy and moving pain-free? First thing is understanding importance of shoulder health. Second thing is early detection of any injuries or any malfunctioning in shoulder joint. Third thing is proper diagnosis. Fourth thing is proper treatment if treatment's necessary. And the fifth thing is prevention strategies in place that will help to prevent any type of problems in the future and maintain the quality of shoulder health you already have and just make it better and stronger. So let's look at it again. 5 things to know and do to keep your shoulders healthy and moving pain-free. So the first thing is understanding the importance of shoulder health. If your shoulder health is compromised, you have pains, aches in your shoulders, lack of mobility, you're gonna have problems with your day-to-day chores, washing your car or cleaning up the yard or picking up a case of water from the ground to put in your cart at Costco, or to pick up your child or throw a ball to your child or play any types of sports. So not to speak about the loss of quality in sleep. When your shoulders hurt, it usually radiates into the neck or to the upper back, and the quality of your sleep gets compromised. And when your quality of sleep compromised, everybody develops this shoulder pain mood, and they're fatigued and plus the pain. So the mental attitude, positive mental attitude is not present, so person's miserable, right? So understanding the importance of shoulder health, and then based on that understanding, educating yourself about the shoulder as a structure, its anatomy, understanding how it's composed and what can go wrong, understanding some conditions that can happen to the shoulders, and then understanding how to detect early detection, which is the second point, to detect problems in the shoulders. Early detection is a key. If you feel pain for a week or so and it doesn't go away, it's never gonna hurt to get a massage or go get it checked out and make sure you address it properly. So early detection and proper detection. A lot of times, all kinds of shoulder problems gets misdiagnosed, and sometimes even detection of a problem is trial and error until the insurance approves the tests that needed, all the way to MRIs and such. So it takes a while to properly diagnose a problem, and proper treatment becomes the next step in the whole process. Based on the early detection, proper diagnosis, a proper treatment will happen. Either some type of manual therapy, whether chiropractic, physical therapy is always beneficial to take care of your shoulders, and do therapeutic exercise to strengthen tendons, ligaments, and also the muscles. But it's very important to understand that there is some soft tissues that needs to be worked at, which is soft tissue manual therapy. Massage therapy comes into the picture to increase the blood circulation in the tissue and help the tissues and the joint to heal. Also to understand that when you have shoulder problems or any type of problems, to avoid certain exercises that trigger the problem and make it worse is a good idea to stop those things, stop those activities. And then when you do the whole 4-point thing, you understand how important shoulder health is, you understand early detection, and you go talk to a specialist when you figure out very first time or first week or so you feel some type of issue is going on in the shoulder, and then getting proper diagnosis and then getting proper treatment, you will learn a lot how to handle your shoulders. The couple of things I would recommend: every time I feel some type of tweak in my shoulder, one of my shoulders, I'm very sensitive to it because clearly my hands, my arms, my shoulders part of my arms, my career depends on it, and my clients and my patients depend on it. So I have to make sure my hands work properly, shoulders being one of the biggest joints in the arm that support all the other structure going towards the hands. So I make sure that I do daily joint mobility exercises for my shoulders. What does that mean? So when the shoulder is healthy, you have full mobility like such in your shoulder, full dynamics. So you could rotate your shoulder in any given direction, in different angles, right? And you feel no pain, and you can actually lift weights in different directions, and your shoulders kind of healthy. So in order to achieve that, you need to prepare your shoulders daily with joint mobility exercises for a given activity. Let's say if I'm gonna do shoulder presses, I'm definitely gonna do a lot of shoulder rolls. I'll do it prior to the exercise, and then I do it afterwards. If I'm gonna do some painting to avoid any severe shoulder soreness and tendon ligament inflammation and tissue inflammation in the shoulders and the neck, I would do a lot of shoulder and neck mobility exercises, and those could be done in small circles, large circles, up front of you, on your side, so hanging next to your body, kind of like dangling the joints. So just mobilization of the joint, soft dynamic movement of the joint helps to keep the joint lubricated. And when the joints are lubricated, they don't really get hurt that easily, so it helps to prevent. So to do this properly, you have to be in proper posture, you have to move slowly and know your limitations, don't cause pain. Joint mobility exercises never cause pain. So if you can't do like a full big circle, you work on the smaller circles. And you focus on your breathing, on your posture, on your mental attitude. You try to stay relaxed, breathe deep breaths, nice long breaths, and just mobilize your shoulders. And I guarantee you, you'll be better off that way. I'm Haigzar from Clinical Massage in Cranford. Take good care.